My name is Yochai Birnbaum. I'm a professor of medicine at Baylor College of Medicine in Houston, Texas. My study that I presented here relates to the increased incidence of diabetes, new onset diabetes found in patients that receive high dose of statins. It has recently been reported in clinical trials and meta-analysis that statins may induce new onset diabetes in patients. While the incidence is relatively low and there is no argument that statin reduce mortality in cardiovascular events, it may be of concern as we are using more and more statins to treat even lower risk patients. The mechanism has not been clear, but we had the hypothesis that it might be related to upregulation of an enzyme called PTEN. The PTEN degrades phosphoinositol 3-phosphate and therefore deactivates the effect of phosphoinositol 3 kinase that is needed for survival and glucose transport. There are previous reports that high-dose statins increase the myocardial level of PTEN in both animals and diabetic patients, and also in the aorta of type 1 diabetic mice. So we gave wild-type mice and mice haplotype with PTEN knocked out in the skeletal muscle. We gave them Western diet plus rosuvastatin, a statin, at 10 milligram per kilogram per day, and looked on glucose, insulin, and glucose tolerance test. And we showed that indeed Western diet plus rosuvastatin increased PTEN and increased insulin resistance with increased levels of insulin, hemoglobin A1C, and glucose, and impaired glucose tolerance. These effects were attenuated in the PTEN knocked out mice. We continued and looked on the effect of cilostazol, which is a phosphodiesterase 3 inhibitor that is used to treat peripheral vascular disease, and previously we showed that it decreased PTEN expression in mice. So we used control animal given normal diet, Western diet plus rosuvastatin, plus cilostazol, or plus rosuvastatin and cilostazol. And indeed we showed again that Western diet alone increased glucose levels and insulin resistance, which further deteriorated in the animals that receive rosuvastatin, and treatment with cilostazol decreased PTEN levels, improved glucose tolerance, and insulin levels. So here we are showing that by increasing cyclic AMP activating protein kinase A, we can reduce PTEN levels and improve glucose intolerance in animals treated with high Western diet and high-dose statin.